Good morning, everyone. I'm Marcie Heggie, a family physician from Yorkton. And as you will find out in my project, I also work in our Yorkton Regional Health Centre emergency room, which is run by family physicians in the community as well. So my project was focusing on improving management of COPD exacerbations in our local Yorkton ER. So why I chose this project? So as working in the ER, I have noticed that there had been a perceived high frequency of visits to our emergency room for exacerbations of chronic obstructive pulmonary disease, or COPD. And this is a chronic disease that is ideally best managed by family physicians in their office. As well, there are tools and steps that can help these patients to actually self-manage these conditions. Also, we have the highest smoking rate in the province in our health region, unfortunately. So we're just under 30% in Sunrise. Saskatchewan itself is actually one of the higher provinces as well too. So nationally, we're just above 20%. In Saskatchewan, we're just around that 25, and like I said, in Sunrise, we're just under 30, unfortunately. So when we looked at some of the data and why these patients are presenting to the ER, one thing we did find is that we do have an advanced population in our population in Yorkton. And also there's multiple comorbidities in addition to COPD for these patients. Current smoking was also a factor. As well, we found that there was a lack of referral to community resources, which can really help these patients to self-manage their chronic diseases. And that was where we chose to focus for my project. So my specific aim was to increase the referral rate of possible COPD patients. So even if they didn't have a confirmed diagnosis or they had never heard about this disease before, they could be referred from the ER to our community pulmonary rehab program. And my goal was to increase it by 50%. And I chose the number of about 5, which I will go over in the next slide, 5 per month by October. So this slide just shows the 6 months prior to the CQIP project starting, what our referral rate was like in total. So this is not from the ER. There was 0 referrals from the emergency room. So to do 50% of 0, my project was done. But on average, we did only have about 3 referrals per month, unfortunately, going to our pulmonary rehab team. When I looked at our cardiac rehab program, which is actually run by the same clinicians, they were getting about 30 to 40 referrals per month. So there's quite a lot of difference between the two streams. So why the poor referral rate? In my improvement team, we were discussing the pulmonary rehab program and other community resources, and I got a lot of faces that looked older than this, but similar to this. There was a lot of, we didn't know we had this resource, and who does this, and how can patients get involved in it? So that's where we focused on, just getting information out. So we updated the referral form so it was A, present in the emergency room, B, it was easy for ER physicians to use, provided education to the RNs, respiratory therapists, and the family physicians who work in the ER, as well as to actually home care. We did a little bit of education with them too, because they work very closely with their COPD patients. We also created a COPD outpatient prescription to hopefully have physician buy-in to referring these patients. And how we did, you're going to have to come see my poster. But in a snapshot of our patient representative, his last comment at our last team meeting was, "It took so long for me to get my vitals done, and there wasn't enough time for stretching. It was so busy."